So how do you know you're a candidate for the procedure? First and foremost, after coming in and performing an exam, if we identify that there seems to be a structural problem, typically and traditionally, part of our history is finding out, do you have other issues? Do you have nasal allergy issues? Have you been told in the past you have sinus problems? Are you somebody that struggles with recurrent sinus infections? And typically and traditionally, the only diagnostic step we really need is an imaging study. So we'll do an x-ray of your nose and your sinuses to really define out what the problem is. And if we see just a simple septal problem, that's one. If we know you've broken your nose 3 or 4 times in the past, we'll see that. If there is some concomitant sinus problems, we'll identify that. Some folks will also have a very significant history breathing-wise problems at nighttime and already know or maybe speculate perhaps they have some sleep apnea, and we might even set you up preoperatively for a sleep study. Those are the reasons to ensure that from our safety perspective, from a surgical standpoint, you are a candidate. Most people in the broad spectrum are. And from an operative standpoint, I've taken care of folks all the way down from children who've broken their nose all the way up to people in their 90s. So age is not a factor. We certainly send folks to their primary care doctors for the simple cardiovascular issues. If you have heart or lung problems, you want to have those managed. And then once we have the imaging study, then we can complete the surgical plan. Are patients nervous about surgery? Well, sure. And what you want to do there is make sure that you come in and see somebody that's board certified in the procedure, more importantly with a fairly extensive history and success rate of solving these particular problems. And then most importantly, being able to walk you through a plan that's going to make sense. And if and when you are capable of visiting with that surgeon and looking at those images together, you can really come up with a comprehensive plan to solve all of those different issues. Typically at that moment, when the plan is really spelled out that way, I think there's a magic moment where the anxiety part goes from fearful anxiety to excited anxiety. Now I'm ready to have this solved. Sounds like we've got a solution to this. Wonderful, let's proceed.